Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. Has climate anxiety ever kept you up in the middle of the night? As there are wildfires and droughts and hurricanes and tornadoes, does this ever keep you up in the middle of the night? You wonder, what can I do about it? You're going to find out today. On today's episode, we have Dr. Sheetal Rao. She's an internal medicine physician at the University of Illinois, Chicago, who's fellowship trained in both climate and health policy and community organizing. So in addition to being an internal medicine physician outside of the clinic and classroom, she collaborates with local communities to improve health and support biodiversity by increasing tree canopy and native green spaces around the Chicago region through her nonprofit organization, Nordson Green Earth. She's also part of the American Hospital Association's Climate and Community Health Technical Expert Panel and is a steering committee member of the Illinois Clinicians for Climate Action. Dr. Rao, thank you so much for being on the podcast.
Hi, Brad. Thank you so much for having me today.
First, a word from our sponsor. Doctors change lives every day, but what happens when life changes yours? A single injury, a sudden illness, your career, your income, your future can shift in an instant. The best physicians don't just plan for success, they protect it. At Set for Life Insurance, they believe financial security isn't a luxury, it's a necessity. True own occupation disability insurance ensures that no matter what happens, your future stays in your hands. Because protecting your income means protecting everything you've built. Visit drpodcastnetwork.co/setforlife today. Secure your future before life makes that choice for you. Welcome back. So Dr. Rao, what inspired you to become an advocate for climate conscious healthcare?
Brad, I've been an environmentalist probably since I was 13 or 14 years old, and I did a school report on healthy diets. And as I was reading about the topic, I learned about factory farms, and I was really troubled about how the animals were treated. And the more I learned about factory farms, it became really apparent that they had a massive environmental impact as well. But it was only in the last few years that I learned about how much of a health threat climate change poses. I think that, like many of us, initially, I thought of climate change as something that affected ice caps and polar bears, which is still really concerning, but feels somewhat more remote and less imminent. Then about 12 years ago, my husband and I left the city for a new home in the suburbs because we had, at the time, 2 toddler boys, and we needed space. We needed a basement. We needed a yard. And as we were moving in, our neighbors came to say hello, and they also warned us that the street sometimes gets water. And seeing our alarm, they said, "Oh, don't worry, but it's only with those 100-year floods." In the first 9 years we lived in this home, our basement flooded 3 times. And it got to the point where my husband and I would pace the halls whenever there was a heavy rain. We would go and check the carpet and look for dampness every single time. And one day I looked up and down our street after one of these floods and saw all my neighbors had padding and carpet lined up for the trash collector to pick up. And I really started wondering what was going on. So I started reading more about it. And I learned that because the climate was warming, the air was holding on to more moisture, which was leading to more rainfall. And that led to some of the flooding, but also some of the land use decisions in our community. For instance, replacing marshland, building homes on marshland, and also having old infrastructure for drainage had also contributed to the flooding. So luckily, we were able to replace the damage in our home, and our town was able to replace the drain infrastructure. And knock on wood, since then, we haven't had any more floods for the last few years. But every time I hear about flooding, after that, it just hit differently. Like when we hear stories on the news about hurricanes and people's homes flooding, I would think about losing power and how their food might spoil, or how they couldn't refrigerate their insulin or their medication, or in worst cases where they lost their home or they maybe even lost a loved one. And just the level of stress that could cause, I was thinking about how we were pacing the halls just for our basement, but what it must feel like to lose an entire home. And I really began to realize how much of a social determinant of health climate change was increasingly becoming.
We're part of the problem, right? Like in healthcare, we are part of the problem. I had read somewhere that we contribute more, we've got more of a carbon footprint than the airline industry, which I found remarkable. But considering what percentage of the GDP we are, it makes sense. So knowing that, what are some things that we are, like, what are the ways in which hospitals, healthcare systems, doctors are contributing to the climate crisis? Like, where are all those emissions coming from?
You're absolutely right. Healthcare accounts for nearly a tenth of our country's total emissions. So something like 8.5% of all of the greenhouse gas emissions from the US come from the healthcare sector. And a large portion of those come from energy use, supply chains, and transportation. Globally, if healthcare was a country, it would be the fifth largest emitter. So it would be up there with the US, the EU, China, India, Russia, all those countries. And so this is particularly troubling, as you can imagine, because our mission is to heal people. And these emissions and all the waste that we create are significantly contributing to disease and harm and distress. The thing that is important to know is that there's no need to compromise patient care in order to reduce our greenhouse gas emissions. And really to ask that would be unethical, because some of the most significant actions that we can take actually don't have anything to do with patient care.
Also, we are contributing to the greenhouse gases. Like I had read that meter dose inhalers, right? The propellant used in asthma inhalers are some of the more potent greenhouse gases. Now they're tiny little inhalers, and then you see a plane up in the sky. Like, it just seems like, how do we get to 8.5%? You said the supply chain and the energy use. Are there other things that we should be aware of that maybe we can change in our day-to-day practice?
For sure. Definitely the most significant ones are energy use and supply chain. But there are other ones. In pretty much every field of medicine, there's something that can be done in order to improve our greenhouse gas emissions or carbon footprint. But really what we can do in the healthcare setting is, number one, energy efficiency. Just like what we do in our own homes, we can turn off lights and monitors when they're not being used. We can use LED bulbs. We can use rechargeable batteries. We have newer hospitals. We're seeing more green building design and buildings that respond to local climate conditions, insulation that doesn't compromise air quality, awnings, window coverings, green roofs, planting trees near our buildings, for instance, for shade and for shelter from wind. Our fleet vehicles are another big contributor. So using, for instance, electrified vehicles. And really, we need to, in healthcare, support policies that make public transportation, biking, and walking the most convenient, inexpensive, safe, and easiest way to get to our facilities. And of course, that's not for people who have any kind of mobility issues, but for those that don't, not only those have the lowest emissions, but they're also the healthiest ways to get around. And so anything we can do to support those, but even with what we serve, the food that we serve in our hospitals, providing locally grown, plant-forward food, sustainable food can be, for our patients and our staff, not only helps people be healthier, but also reduces our carbon footprint. And we have so much evidence on how those foods reduce the risk of heart disease, cancer, diabetes, all those things. And then waste is another huge one. We create a lot of waste in the healthcare industry. There's a lot of single-use plastics. So in our cafeterias, for instance, plates and cutlery could be reusable. Compost is huge. So food waste creates methane gas, and that is anywhere from 30 to 80 times as potent as carbon dioxide. And so composting, whether we do it internally within the hospital or whether we outsource it, can make a really significant improvement in our climate footprint. So those are just some of the ways. And really none of those have anything to do with direct patient care.
Yeah, composting, that seems something that would be somewhat simple to do on a national level, right? Like, you recycle your plastics and paper. You just have another day for like food waste. Yeah, it would be gross, right? All that food waste mixed together. But then that all gets sent to some central facility that is then managed in a way that you could probably sell. Just group all food waste together, right? I compost, and you're not supposed to do. There's certain things that you're not supposed to do. You don't put any animal materials in there, but there are ways to do it where you can. That just seems something maybe not simple, but yeah. And then, like you said, it creates less garbage. I'm sure it'd be great fertilizer for farms. Yeah. So whoever's listening to this, if you're in a position of power to influence something like that. Speaking of which, so one of the things that you've written about is taking action being an antidote to feeling overwhelmed. And I know one of the reasons I'm doing the show is I have climate anxiety, right? This is one of the things that keeps me up at night. One of the antidotes to that is action. So what are the ways that healthcare professionals can channel their concern into advocacy or systemic change, like something bite-sized that we can start with?
Absolutely. So I think first it's important to have some idea how you contribute individually or your family contributes to climate change. And there's calculators online to figure that out. Before you use those, though, it's important to know that those calculators were originally popularized by fossil fuel companies who have known and purposefully hid the health and environmental harm of their product for decades. So they made these calculators to shift the blame off of themselves onto individuals. So it's important to know that because there's a lot of shame and blame that goes along with climate action sometimes. And I think it's really important for this issue to get better that we remove that and really focus on what we get instead of just always giving up things and who's doing the best job of giving up things. It's really, we need to think of this issue as like all the great things we get. So clean air, clean water, green communities, walkable communities, things like that. So once we think of it that way, I think that's really important. But also individual actions are important and they're not always easy. There are some easy things that everyone can do. For instance, in their home, they can eat less meat and dairy. No one is asking anyone to become a vegan unless they want to. But even just eating less makes a huge impact. Eating seasonal and local foods makes a difference as well. Wasting less food and composting, as we discussed. Driving less and flying less whenever possible. I wish we had a better kind of public transportation infrastructure and train infrastructure in the US, but whenever possible, it's always great to take the trains instead of the planes and really plan around. For instance, if I have to go to a conference, I might stack a vacation on top of it just to reduce my carbon footprint a little bit whenever that's possible. We can all work to electrify our home and increase the energy efficiency of our home. So we have ComEd out here where I live, and they are the electricity provider, but they will come out, and many of these providers will do this. They come out and do a evaluation of your home and help you make your home more energy efficient, and it's actually free. And another really big one is just reducing consumption of things, like buying less stuff. Everything that we buy uses energy. Manufacturing things uses up energy to create it, to transport it, to get it into our house. Water is used up as well. And so just overall, we have a very kind of consumer-driven society, and really taking a step back and thinking about whether we really need every single thing that we buy. Reducing that is something that we all can do.
It's not fair. You've got these fossil fuel industry people who own football teams and fly in private jets and are destroying the planet and living like fat cats. And you're saying use less, travel less, consume less. It's just not fair.
Yep.
So what would you say to someone, me, for instance, who says that?
No, you're absolutely right. And actually, that was the second part of my answer, which I forgot to get to. So I'm glad you asked that question. I think these actions, these individual actions are really important, but they're nowhere near enough. And in order to combat climate change, there has to be just an overall societal reduction in our dependence on fossil fuels. Overall, we just need to rethink how we live and how we fuel our cities and towns, how we produce food, how we get around. And we need collective action at every level. I just came across a quote from Rebecca Solnit where she says, "The revolution won't happen by people staying home and being good." And this is where the government, and right now that might mean more local and state than federal, but that's where they can come in and help to make the most sustainable option, like I said earlier, the one that's the safest, the cheapest, and the most convenient. Because people are busy. We all have a lot going on, and taking significant amounts of time out of our life to go and do a bunch of different climate actions is just not possible. And so in order to change behavior, I think policy is the answer. And so I would say pick some of these individual actions that I mentioned and make those changes, but please don't stop there. And don't forget to go out and vote, for instance, for climate champions and support climate-friendly policies and donate your time and resources to organizations that are already doing this kind of work.
And as you said, at the local level, because at the federal level, they are rolling back all those regulations, which is it's feeding the fire, unfortunately. If you like this podcast episode, you're going to love the podcasts over at the Doctor Podcast Network. For instance, Telemedicine Talks. Telemedicine is revolutionizing healthcare. Dr. Lee Damasco and Phoebe Gutierrez, Telemedicine Talks, bring you to the forefront of this digital transformation, featuring insights from pioneers and practitioners. Stay ahead of the curve, subscribe to Telemedicine Talks, and navigate the future of medicine with confidence. So let's get back to healthcare specifically, though. When you're interfacing with healthcare leadership, right? You highlighted a number of things that will actually save money, right? So you're going to be speaking their language. Do you have any recommendations for someone who wants to take this on with their healthcare organization in how they interface with the leadership in a productive way?
Absolutely. I think, first of all, just recognizing that this is already affecting our patients. And so this is our lane, like anything else that affects public health. So it's worth taking the time to understand it, because whether we recognize it or not, or our leadership recognizes or not, our patients are already suffering from an increase in heat-related illness, allergies, and asthma exacerbations, just to name a few. And we know that although the medical care we provide is crucial, it only accounts for 10 to 20% of the modifiable factors that affect population health outcomes. And the rest of our patients' health is really determined by stuff that's outside of our hospital, outside of our clinic. It's those social determinants. And climate change affects every single one. And so I think it's important to, if you have a green team at your hospital, to join it and see how you can help. If you don't have one, think about starting one. Or if you have a state branch, for instance, in Illinois, we have the Illinois Clinicians for Climate Action, just getting involved with them and seeing where you can help affect things at a state level or a regional level, or even just giving talks or volunteering for various activities just to increase the awareness of this issue.
When you said earlier, turning the lights off and reusable products, and all of these things seem to have a common theme, which is they were saving energy and saving money, which is ultimately what they want to hear, right? They want to hear, yes, we're doing this for the patients, but they're also going to say, how much is this going to cost me? And your argument is, actually, this is the way that we save money, but you have to put the money in and put the effort in. So how do we determine what figures that we can use? It all seems so abstract. If you're just starting in this space, are there resources out there or places we can go that will help us to figure out how to go about making these changes so that we can sell it to leadership in a way that they want to hear it?
Yes, absolutely. There's so many resources out there. So there's Practice Green Health, which is an organization that kind of helps hospitals and healthcare systems to gives them a map of how to make their hospital more green. The Joint Commission has a certificate right now that isn't mandatory, but has some great resources on how you can go about taking steps in order to make your hospital system more sustainable. There's a lot of resources out there that can help you make the case for that. At the individual level, all of the ideas I shared earlier are non-healthcare related ideas, like you mentioned, with reducing our energy use and things like that, or electrifying our fleets. But there are also some actions we can take that actually do directly impact patient care. So there's an established initiative called Choosing Wisely, and it's created by the American Board of Internal Medicine. And it encourages clinicians to reduce their overuse and unnecessary services and improve patient outcomes. So basically, it's just good medicine. And all of us in our fields have a way to practice good medicine, because every CT scan, every MRI, every blood draw, every IV medication has a carbon footprint and a monetary cost. So choosing wisely basically says, don't order stuff that's unnecessary and it doesn't result in better outcomes. No one is saying don't get the things that people need to get. In Canada, actually, has a climate-focused version of Choosing Wisely that lists several examples on its website. So that's a great resource to go to as well. And it's also really important here, and this is something that you can say to leadership, when we have medical waste, healthcare is so expensive and it's not very transparent. And that erodes trust between patients and physicians, because the costs can be unpredictable and they can be prohibitive, and it causes people to sometimes avoid seeking care even when they need it. And as it is, we already spend more than any other nation on our healthcare, and we don't even have the superior outcomes to show for it. But in every field of medicine, there's a sustainable action you can take yourself or convince your department to take on that can help to reduce the cost and just practice better medicine. So for instance, in primary care, you had mentioned the DPI inhalers over the meter dose inhalers, and that's more for adults. But in all primary care, advocating for telehealth, it's still going to be covered, I hear, for another 6 months. Patients love it. And with the right setup, it can be great for physicians and other providers as well. Vaccines. People don't always think of vaccines this way. And I know it's such a controversial topic right now.
Listening to my show, it's not controversial.
People from getting sick. Pretty much everything that we do in primary care reduces the carbon footprint of healthcare, because hospitalizations, particularly ICU admissions, every ER visit, all of those have a carbon footprint. Of course, they're bad for patients and we don't want them for that reason anyway. But just putting that aside, if you're looking simply just at cost, keeping people out of the hospital, keeping people out of the ICU and out of the ER, that's not only good medicine, it actually reduces your carbon footprint. And then with hospital medicine, switching to oral medications like antibiotics as soon as you can, getting off those IVs. In the surgical setting, switching to the isoflurane, which has a really massive carbon footprint, to desflurane. One example,
or
for
switching
instance,
away
in
from
my last
desflurane.
job, switching away from desflurane. I think it's desflurane is the lower carbon one.
I think it might be the other way around, but if you're an anesthesiologist and you're looking into it, you can quickly look this up and figure it out. But whichever one it is, there is one that has a significantly smaller carbon footprint than the other. We're coming up with our final answer.
You're right. So desflurane is worse than isoflurane. So yeah, moving to isoflurane.
And it's pretty straightforward. I don't know how interchangeable they are, but our anesthesia colleagues will know. But from the little that I've read about those that have made the change because of the carbon footprint, their patients are fine.
Yes.
At my last job, our green team switched from plastic coffee pods to sustainable coffee pods. So that was a small action. We just switched from the supplier. And that also has a health benefit because of the heat. We're learning more about how microplastics into our bodies when we consume the contents of those. So that was one more sustainable action that led to a health benefit as well. Those are just some of the actions that physicians can take at an individual level or a systemic level to reduce their healthcare.
Extremely well informed about climate change. Something that you wrote really resonated with me, and that was, my desire to be well informed is currently at odds with my desire to remain sane. So how do you remain sane?
So in my community organizing fellowship, one of the first lessons we learned was find your people. And these last few months have been challenging, to say the least, for so many. But I think for me, it's been the community that's kept me sane. And so my recommendation would be to find your people. So join a group locally, preferably in person, where you have a shared goal and you can work on something together. Join a garden club or a green team or a climate book club, or start one if there isn't one. Get involved in your town, tell them to plant more trees or native plants, or start the composting initiative. I was in a green committee in my town several years ago, and we had a rain barrel decorating contest. The rain barrels collect rain, and then you can use that rainwater to water your garden rather than using other fresh water. And the decorating contest was really fun because they asked all the local schools to submit a decorated rain barrel. And it really brought attention to what those are, because I honestly didn't know what that was until this contest. And then they auctioned off the rain barrels and they used that money for various sustainable initiatives throughout the town. And the really neat thing about these climate actions is that they not only improve the health of people and planet, but they also connect people, which ends up addressing other issues we have, loneliness and isolation and things like that. I also recently joined the board, as I mentioned, of Illinois Clinicians for Climate Action, and it's been really great to meet with other people with a shared purpose. And sometimes we meet up in real life. Just recently, we went to the Hill in DC and we spoke to legislators about the health benefits of the Inflation Reduction Act, because that's under threat right now. And it was really energizing. For me, clinical medicine is really rewarding, but of course, as we all know, it has a number of challenges. And for one, physicians have so little time to address so many issues in our clinic visits. And sometimes it just reminds me of that public health allegory where the bathtub is overflowing and we just are mopping up the floor, but no one is actually turning off the faucet. And it's a feeling that, in my experience, really contributes to moral injury and burnout. So collaborating with others to work on upstream solutions like policy change, that feels like turning down the faucet. Maybe not turning it off, but it's affecting upstream change. It's really healing. It's really energizing. And so my environmental work gives me a sense of agency that sometimes is harder to find in clinical medicine, but my patients remind me why I do it. So both parts of my job really complement each other.
Yeah, sometimes I get asked career advice for earlier physicians or medical students, residents, and one of the things that I say is you should always have something that is either outside of medicine or medicine adjacent, because eventually seeing patients can become, as like you said, it feels like we're just mopping the floor. And so you need to have something else that, and also it can become mundane after a while, right? See the same patients, similar problems day in, day out. It can be wearing. So something that is ever changing and evolving that you can use other parts of your brain for. And if it's clinically related, great. And if not, also great. But find your thing that's not just seeing patients, I think is really important for all of us to keep our sanity. And the fact that you're doing something that's going to benefit all of us, really thank you for what you're doing. And especially in light of the current administration. The next question, it might be the same answer that you just gave, but I'm wondering if you have a different one. What gives you hope?
So in 2020, a friend and I started talking about starting a nonprofit. And in 2021, we founded Nordson Green Earth. And the reason I mentioned 2020 is because, as we all know, the world was crazy and there was so much going on. And there was, of course, the pandemic and burnout. And I actually stepped away from my clinical career for multiple reasons also, because my kids needed me and things like that. But there were the George Floyd murders. At the time, the nature paths in the city and the lakeshore were shut down because there were too many people congregating, and the mayor was understandably concerned about the virus being transmitted there. So there were people, including my friend who lives in a high rise in the city, unable to really get outside, unable to be in nature really at all. And it really made us think about how the access to nature is unequal. And I think that we knew that subconsciously, but it really was something that we formally learned about at that time. It was very eye-opening. And so Nordson Green Earth, our mission is to work with communities that are historically disinvested from nature and from tree canopy and suffering the health impacts of that, like heat islands and pollution, and to work with them to increase green spaces and plant trees. And so Nordson is what gives me hope, because we're really 4 moms now that are running this organization, but we have partnered with wonderful community members. We do a lot of our work in the south suburbs of Chicago, and these are communities that have experienced a lot of climate injustice, environmental injustice, not so much redlining because they're suburbs, but more so the highway acts where they were torn apart because highways were built and in the middle of their community. And those have now led to air pollution and noise pollution and really not very walkable communities because of that. So we work with these communities. We've got amazing community members that we work with that guide our work. We've got our first planting. We planted a tiny forest in 2021, and it was led by 25 middle school kids. The kids gave me a lot of hope. They were so excited. They said, I can't wait to bring my kids here and show them the forest I planted. Our second project was a native butterfly garden. At the time, the monarch butterflies were added to the endangered list in Illinois. We had the local high school art club draw big murals of monarch butterflies that were shaped like books. We partnered with the local library to create a native plant garden reading nook where the librarians read stories to children and they can be outside in the greenery. Our upcoming project is going to be a walking path because a lot of the people in the community are saying that they don't have a lot of places to really have access to nature and to get exercise outdoors. So it's a walking path surrounded by native plants right outside the same library. We have a great partnership with the library director and the board there. And that's actually being planted April 11th. And so it just feels really good amongst all of kind of the negativity and a lot of investments being taken away from tree planting and environmental justice. It feels good to be able to give something to this community and really unite and bring together a community. We're going to have kids at this planting as well and really give them something amazing that they can use.
Amazing. So if you've inspired our listeners, they want to get in touch with you, how do they find you online?
They can find me on LinkedIn and they can find me on Instagram. Those are probably, and Blue Sky. Those are my 3 kind of social media outlets I'm on.
And what are your handles?
Email me if they'd like.
Fantastic. So Dr. Sheetal Rao, thank you so much for your time. Thank you so much for all you do for your patients and for the planet.
Thank you so much for having me. This is a great conversation.
Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it or like it or comment on a social media post or write us a 5-star review, something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee and don't represent the views of their employer or even their significant other. Even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice or financial advice or really any advice. Thank us again for listening to The Physician's Guide to Doctoring.